Again, good afternoon. I am Bobby Joawi, the Director of Product Development here at the Alliance. So today I'm joined by Garrett Giroux and Nicole Oishi. We're going to talk about best strategies to communicate with employees about their health plan choices. An effective communication strategy does not have to be complicated or time-consuming. For those of you who may have missed it, we did do a webinar a few months ago called Beyond Open Enrollment, Keeping Benefits in Focus Year-Round. It is available on our YouTube. If you didn't know we had a YouTube, we do have a YouTube channel. And I encourage you to go back and watch that. Today's session will build upon that, upon the strategies shared in that piece, and then we'll delve into critical aspects such as the role of brokers, vendor collaboration, and network selection. And we'll explore how those elements contribute to empowering employees to make informed choices. So I'm going to start off by introducing our panel. So Garrett is going to go first. So he is a partner at the Insurance Center and a corporate benefits consultant, spending the last 18 years dedicated to helping his clients improve and rethink how they buy and provide real health care, not just health insurance. He manages a self-funded cooperative health plan strategy called Ticket Health right here in Wisconsin. He helped create a separate pharmacy benefits firm that brings real transparency and results to members, so much so that he has the lowest net cost 2 years in a row with the PBMs he uses over his entire book of business. Garrett's also a cancer survivor that is fueled by his own health experience every day for the members that he serves. So welcome, Garrett.
Thank you.
And then next, I'd like to introduce Nicole Oishi. She is the Vice President of Execution and Service Delivery at WPS Health Insurance with an impressive career spanning over 3 decades. Nicole brings a wealth of healthcare expertise and 15 years of executive leadership experience. Her background encompasses leadership positions at healthcare companies including Acerta Health, Matrix Medical Network, Collective Medical, and Cambria Health Solutions, where she excelled as the general manager of their self-funded business and VP of Clinical Solutions. Thanks for being here, Nicole.
Thank you.
So we're going to go ahead and get started. Garrett, we'll start with you. What role do you believe a broker plays in employer benefits? And how do you believe that brokers should support employers in creating those benefit plans?
So a really loaded question, I think, to start. I think it depends. I think it depends on the knowledge base of that broker, and I think it depends on the knowledge base of the employer. And I think you have to figure out that dance early on. I think the coolest thing to me is when each party admits that they don't know everything, and it's an ever-changing landscape, especially here in the Midwest, in Wisconsin. So for us, I think we need to slow down. We need to make sure that we're on the same page for even definitions of what is insurance versus healthcare financing. What are we buying versus what are we going to keep here as a self-funded plan? And once we understand that and that trust is starting to be created, I really think it can go a long way when you look at the long-term and short-term strategies for an employer, but you got to understand what those are too. And I don't think enough companies understand that across their whole C-suite. Smaller firms that might have an HR person doing way too many things. And I think you really got to slow down and ask them, what are they looking for? We had this past week, we had a group reach out to one of our consultants, said, I don't want a broker. I want you just to do an RFP for me. How much will it cost? And he came to my office and he goes, well, how much should we charge to do an RFP? I go, an RFP of what? Because are we doing a pharmacy diagnostic where we're looking at everything that they're spending in the last couple of years on pharmacy to figure out the savings? Or are we just spreadsheeting them with a bunch of carriers to beat up the current carrier and not take it really? So I think you got to get into the weeds on some of those questions. And in that example, by the way, they said they had to think about that and then get back to us, which they still haven't yet, which is fine. But it's one of those things where they go, we don't know what we're asking for quite yet, actually, out of you. And if we don't set expectations early, we're going to miss a lot of times and then get lumped into a definition of just another broker.
Absolutely. I think, it's funny because one of the next questions here was what questions should employers be asking? I think it's also what questions should your broker be asking? And you
Yes.
hit right on that. Like, what is an employer's strategy? What do they want to do in the next year, 2 years, 3 years?
Yeah, we call it the due diligence process, right? And that is a meeting all in itself with a potential client or a new HR director, because they don't ever change businesses, all of that. And even a new CFO that comes into a business. And anytime anyone changes over, right, they're coming with where they were before and another team that was probably with them. And they have their ways of thinking through what that looks like. But as that due diligence process comes to be, we all get beat up a lot, both consultants, the HR teams, the members by the experience. We got to make sure that we're in harmony and simpatico and on the same page together, and that there's that true trust created. When it comes to like the questions to ask, we both definitely want to ask questions. A couple of them that come to mind for me that I always like to ask is, after we do the due diligence process, at the end of the day, if 5% of your population is going through unplanned, high-cost things, who do you want at your side to help them with that experience? Because the reality is 95% of the population is pretty easy, right? They're not getting into their out-of-pocket maximum. They're using acute and episodic care that's pretty easily managed for the most part, though you may have to walk them through how to get to the right place at the right time at the right cost. Holding the hand of that family and that member when they're going through the worst thing in their life is what I think our role needs to become more than a broker that's just throwing numbers at you.
Yeah, I would agree.
Yeah, the only thing I would add to that is I think the other question to ask is, what are you dissatisfied with, or what isn't working today?
Yeah.
Because I think that highlights then for you as a broker, but then also for us as a carrier, like where do we step in and where can we add value, and who has the right value prop to match the problem or the challenge that we're trying to fix? Because if you go to the wrong one, the problem's still there.
Absolutely.
Absolutely. So next question, this one's for you too, Garrett. How about the role of networks? Where do you see networks playing a role in a employer benefit plan?
Networks today, it's such a wide spectrum of who you deal with. I would say for us, right, we're here sponsored by ultimately a network and spending the time with the Alliance. What I like about the Alliance is that they are nimble, they're open-minded, they're willing to go out of their way to find a provider if it's the right thing to do for a business. So this past week, we had a client who had a behavioral health physician or counselor, if you will. She's a one-person shop. She started out on her own a couple years ago, not in network with the Alliance. She happens to be in rural Wisconsin. The business is all around that area, and people would like to see her. And they don't want to have to guess on what the cost is going to be. And frankly, people that want to get mental health care needs, which is a passion of mine, it shouldn't be a cost deterrent to get to the 5 trusted visits to establish that trust, plus then continuing care. The Alliance last week, via text from me, said, I think it was to these two, Bobby Joe and Mike in the back of the room, get her in network, please. Was it yesterday or the day before, she's now in network with the Alliance. And that was a big deal to this employer. It was more a big deal to the person that wanted to continue to see that, but wanted to be able to afford it and have it count towards, their health care out of pocket at times. And we know today that the paycheck is running out more than ever before, it seems like. And so I never want to hear someone isn't getting to their behavioral health the way they need to. So that's the nimbleness and the open-mindedness of a network so important that way, is a couple of examples.
And then I would say the other piece is making sure that when you're looking at the value from a facility perspective, right? People don't usually pick a provider based on the facility, right? They pick based on the doctor that they're going to see, and making sure that those two are married so that the surgeon that's in your network is the high value facility, has outpatient, so you can maximize those healthcare dollars so that you're not ending up having to pay more for something just because of the facility that provider's associated with.
I would agree.
Which leads to another thing you do very well. The Alliance is very good at having us consultants go to them with claims data and having them do the work with Ryan and that team to make sure that as we're doing both a disruption on what big network that might be in play today versus the disruption if they move to the Alliance, stay in the Alliance, look at other options, breaking down that data and seeing the disruption from both access and costs is a big deal. But also, as you've heard in some of the other panels earlier today, if you start to get towards tiering your plan, narrowing your network, getting rid of co-insurance altogether and just going to a copay style plan, that all has impact, of course, on the budget and the budget for the employer. And as you present all these creative ideas, they also go, that's great, but what's the cost to it? And they can help with that more than some of the other networks that are out there.
Absolutely, which I was just going to say, I think that is one thing that has surprised me, and just really from a value perspective, is the ability for us to just be able to provide that data to employers, because I've worked with multiple networks before, and it's not as easy to just, hey, I need this, and basically it's right at your figure, and it's an employer's data. So that's the other piece. It is their data, and the ability for us to be able to work with their brokers directly with employers to provide that is awesome.
The other thing my industry has been good at is trying to sell to companies the fact that, well, I can go get you a direct contract as a consultant, and in a perfect world, us consultants should be coming together with the alliance and the employers in that region and going out collectively with this cooperative model to go get the contract together.
Yes.
Because it's really better, it's better for everybody.
Correct.
And if Garrett's got a direct contract here and then 3 others over here, it actually complicates it for everybody.
Yep.
And why not use the law of large numbers with 450 groups in the alliance now to go get those done? And I challenge the alliance today a little bit too to use us more to negotiate some of those contracts, as well as the employers in that region, to put all of them at a table to say, well, why can't we get this better? Yes, we're trying to do it to a reference base of Medicare, awesome. Yes, we're trying to get to all these bundled rates where it's known up front so we can actually transparently share it with the member at the time. And I think we can get there, because I think as you're seeing all the moving parts in Wisconsin right now, and new administrations coming into a lot of hospital systems that maybe made decisions 3 or 4 years ago, are now willing to make different decisions today.
Yep, different conversations.
The employer's voice is very powerful to sit down at the table and have those conversations with provider groups.
I think it's more important than the,
I have
frankly,
seen
the
it be
alliance.
very effective at getting rates.
Yeah, not to overshare on so many stories, but we have a system in central Wisconsin right now that the alliance has reached out to like 4 or 5 times over a 3-year period, doing their due diligence. It wasn't until the leadership at that hospital found out from a friend that his friend's employees weren't going there because they weren't in networks. He went down to the CFO and said, get the deal done. I got that sort of right, Mike? Okay. So it just takes that curiosity. That curiosity is everything.
Yeah. And I think employers are more, they are more apt to get involved now. I mean, things have changed, and employers really do want to get involved and have those conversations with providers, where 10 years ago, even 5 years ago, they weren't.
Yeah, the advancing free market healthcare group that's really growing in number here in Wisconsin. If you're an employer in the room and you're not a part of that yet, I really encourage you to ask some questions of the Alliance or other consultants in here about that, because it does have layers of both federal, state, and other movements that can happen within to try to say, we have a voice and this is what we're asking for.
Yeah, absolutely. So Nicole, we're going to switch gears a little bit here. And what should employers be looking for when choosing a TPA?
It's a very good question. So the things, I go back to my previous point, the thing that is most important when I'm talking to somebody is, what is it important to you? What are the challenges that you're having today? What do your employees need today? What are you looking to solve for? Is it around clinical management? Do you need more clinical support? Is it around utilization management? Do you feel like you're paying for services that you shouldn't be paying for? They're not medically necessary. Is it customer service? Are you folks spending time on hold or not getting their questions answered? So to me, the most important thing is aligning your value prop and what your needs are with who the TPA is, and doing your homework, checking references, talking to other employer groups that use them, and understanding that, is that value prop really aligned with what I'm looking for?
Right. And even those that have used them but left. Because that's not always a negative, but it's a good path to go down. You're not just in forced business, but also those that have exited, and why. You can also tell a good story.
I would just add, the days of a TPA being only a medical claims processor are gone. We're asking more of our TPAs than we ever have, and we should, because they need to evolve as well. And so I think their clinical teams are so important. You really need to know if your TPA is outsourcing most of your case management, utilization management needs. If they are, there's a delay. There's some great outsourcing for specific comorbidities, of course, but if you have a TPA who has doctors and nurses that are right down the hall from the account executives that are also working on the reason that prior auth is needed, or the reason why the member feels like they're kind of trapped in this telephone game, it's really that important. And I think the TPAs that are willing to also allow steerage because their networks allow it is very important versus
Agree.
the answer that, well, we're part of this other company, we don't like you steering the way that you are because of our network contracts and the way that they're set up.
Yeah, agree. So Garrett, next question's for you. How do benefit vendors work together to provide a seamless and comprehensive benefit experience for employees and their families?
Well, they don't all work seamlessly together for sure. But there's a convenience charge, if you will, for when certain carriers bundle everything together for you because they've created and spent the hours of putting in the time to have that seamless package to offer you, right? That's what fully insured really is. It's the fact that they bundled it nicely for you and they're going to charge you 4 to 11% to take that package. If there's an unbundling of all that service, like in the self-funded arena, where we can then rebundle it with like-minded cost containment programs, vendors, people that are willing to put in the future hours to do the right thing for the membership block and keep costs down, you have to, on the front end, get that commitment of what the time looks like. A few of these vendors are in the room and they're great to work with, but flowcharts are good. So if you know, right, if you're putting in a cost containment program like Smart Infusion, the TPA needs to know what the heck you're doing, the PBM needs to know what you're doing, the care navigators need to know what you're doing, your team needs to know what you're doing, and Smart Infusion needs to know what you're doing.
Right.
There's 5 different teams putting together a new program, and you better have prepared to have hours of conversation and responsibility laid out to make it work well, because the member experience is everything, and they're going to tell all their coworkers and family members if it doesn't go well.
Absolutely.
So the seamlessness comes with get to know all the different vendors that are out there too, because there's so many, right? How many have vendor fatigue in the room, including consultants half the time? It's, yeah, 2 hands went up in the back from one person. You want to almost do the Mr. Rogers neighborhood visit, get to know them, get to know their culture, get to know their people, and see if they fit and if they're aligned on what they're caring about and also their fee structure.
Yes.
So we only work with vendors that will only work for a PEPM and not a percentage of savings of anything. We want to have a pretty known budget for using those partners, and we want them to make a modest profit, which isn't a bad word, right? But we don't want them to be taking what could be 20% savings and all of a sudden the employer's down to some smaller fraction.
Percentage of savings on billed charges is my favorite
Isn't
one
it?
that I'm unwilling to do. I will say, I mean, just, and again, I'm a nurse too by background, haven't touched patients in a long time, but I think it's setting the expectation too, because when you do have vendored services and files are getting transferred, and then you have vendors or folks saying, oh, it's real time, it is not real time. And I think we say those things and people go into it expecting it to have a fully seamless experience. And the fact of the matter is it doesn't work that way. So being realistic about what it actually means to add vendors in, and it may not be bad, and it may not even make care worse. It may actually be better that there is a delay because sometimes people didn't actually need that MRI. But I just think sometimes I hear people say, but they said it was going to be seamless. And I'm like, well, that was a lie out of the gate. So
Yeah. As a consulting team, right, it's way more than Garrett. I have an amazing team around me. And the best thing that they do is we try to make sure there's like a bi-weekly call or a monthly call we set up with all the clients. Even if you don't have anything really urgent to talk about, things come out of those calls that are some of those missed expectations or just clarity around the communication about what needs to happen in the order, because we really should be working well ahead, right? unfortunately, in our industry too, consultants get hired like 90 days ahead of time before the renewal, and now we're out of time and pressed to do everything we possibly can. We should be hired and be trusted 6 to 7 months before your decision has to be made for that next benefit as well, so that we can do all the work necessary and really effectively communicate with all moving parts.
Yeah, and what you said, I think, is extremely important, because we went through this with an employer, and I think she's in this room right now. But we from a network perspective, work not only directly with the employer, their TPA, their on-site clinic, developed a workflow, but that was like months before it ever happened. And granted, everything is not 100%. You're going to have bumps in the road. I think you actually said this during our prep call, is like mistakes lead to successes. So if you're implementing a brand new process, you know that there are going to be some bumps, but ultimately you're all working, if you've got a good group of vendors, you're all working for one common goal, and that is to honestly make healthcare easy and to help out the employees and their families. So, yeah.
Absolutely.
Yeah. Next question. So Garrett, can you provide some examples of successful collaborations between brokers and other benefit vendors in supporting employers and their covered employees? You've had some good ones so far, but if you have others.
Yeah, I think our role is to quarterback the idea, and we are not nurses and doctors by any means as consultants. We pretend to be them, unfortunately, as well as lawyers, therapists, and everything else at times. But I think what we do, we set the stage, we put the expectations out there, and then we should try to step back and let the specialists that are desired for an outcome to kind of really get to work on it and come up with some of those solutions. I also think we need to keep the employer and the decision makers involved in that process to know how it works and all the moving parts, otherwise we miss on that expectation too. Whether it's rolling out a new pharmacy benefit manager, which can be months of a task, or for those HR people in the room that change HIRS systems every 3 years on us. We know how painful that is and what it takes, but we live in a world of now EDI feeds and so much technology that is not my strong suit, that we just need to make sure we're collaborating really, really well and over clarifying who's doing what and when. And then I would say the other part to the success when working with vendor partners is that make sure the employer and the members they know they have permission to bring up the misses, right? I have a client in this room right now who it is not to just point a finger, it's to not have the miss happen again and to get better every time we have one, because they are going to happen, to your point, all the time. It gets messy at times, for sure. Then you got human emotion going on when things aren't going well, maybe at the pharmacy counter or, at a clinic, and as much as the people at the front desk, the hospitals are trying to file your claim correctly, somehow they manage to not do it once in a while correctly. All that stuff's going to happen. So we want to make sure that the open dialogue and the trust is there, so it gets cleaned up as fast as possible, but the member knows what you're doing, and then the employer and their team knows it's okay to bring that stuff up and not worry about hurt feelings.
Right.
And I think bringing it full circle to the topic here is, if you're going to have a bunch of vendors and people have to use other vendors, making it very, very clear, and not just at open enrollment, about who I'm supposed to call when, and making that information available in all sorts of ways for my employees, and not just my employees, but their family, the families that are covered as well. Because I think people hear things at open enrollment and they know there's all these vendors, and then there's all this stuff on the ID card that you need a magnifying glass to be able to figure out. And then there's real life, right? And something happens and I'm at my worst, something really bad is going on, and who the hell am I supposed to call now, right? And I think that's where a lot of times we fall down, is we don't make it clear, we don't make it easy, we don't make it digestible, and we forget about all the people around the employee who may also be the primary seekers of care or managing the care for the family.
Yeah, we replaced the customer service phone number on the back of every ID card with our groups, with our nurse care navigators. Just not willing to tolerate just the telephone game that happens to get to the right result. And we have a very intentional phone tree of 2 questions to get to the right person? Is it an existing claims question or for a previous visit you have going on? Or is it about future care navigation to high quality, fair price places to go? Press 1 or press 2. But it is not somebody it's not a phone bank of 100 people. It's the same 4 people for every client that we assign to those groups, and that's been very, very helpful as well. The other thing for the employers in the room is work with your consultants to get the BAT line number or the cell phone number to all the moving parts and partners in the solution. They don't mind hearing from you all once in a while too. And occasionally, right, I'm a dad of 3 kids under 5. If you can't get me, at least having other phone numbers is kind of helpful too once in a while.
Right, absolutely. A good call tree.
A good call for you.
Nicole, what are common reasons employees often feel confused or frustrated during open enrollment, especially
Everything he
when
just said.
selecting their health plan benefits, right? It's like a culmination.
I think, the attempt to make sure that people get the best of everything, like I remember back in the day, I'm old and have been doing this for a long time, but there was this huge push to break everything apart because then you would get the absolute best expert at everything. And then the market, 10 years later, it was, nope, package it all together because then it's seamless and people don't get, and I think some place in the middle is probably where we're going to end up landing. And I think being really clear about, first of all, why do I have this? Am I adding this benefit on because I think in another session I heard somebody, this sounds good, but A, it's not the employer, I don't even have this problem. I don't really want to focus my energy on this, but I'm going to bring this. So then now I've just got more vendors and more things, which people I think just get fatigued. Yeah. But being very, very clear, these are the 5 things that we're doing. Here are the reasons why we're doing it, and here's the phone numbers to be, or the modes of communication to get that. I think that to me is being clear, focused, and targeted on the things that you're trying to solve for with that population. And I feel like we get lost in the myriad of shiny objects or solving the latest thing that we heard on TV, right. Or back to the fact that 80% of disease is caused by lifestyle choices, right? So get to the root of what you're really trying to solve for.
Yeah, 18 years of doing this, I don't get offended at all anymore when it comes to people not remembering things. I had this rule in the airport, so you can all steal this later, and you're flying out later. So if you just go into it assuming no one knows what the hell they're doing, you'll never be let down or disappointed, because that's what will happen. But it's when we assume everybody knows everything that then we get upset about the thing that's happening. For me, last month I had a group I've insured for 10 years. Let's say they have new hires and turnover that happens at 15 to 20% every year. So it's a new population that's learning what I created, right, with my team that has never seen it before. So instead of doing just the normal open enrollment strategy, right, we played Jeopardy. It's a contracting business of guys that do not want to be in that meeting with me during that time. And they learn more through a game of Jeopardy with category questions where I put them head to head. It was a room like this, and I made 2 by 2 go head to head until it was down to the last 2 people. And yeah, we got some bad answers that came out of people on definitions that you would assume that they would know. But they remembered more from that one meeting than they did from the previous 9 years because I gamified it a little bit. And guess what? It was a 7:30 a.m. meeting that I had an hour and a half drive to get to. It made it fun for me too as a consultant to mix it up like that. So have fun with it too. Once in a while, change it up. Because when we spew things for an hour and they retain 5% of it, it's frustrating for them as well. When it happens to them, they just want to know they have a good team to be there for them.
Absolutely. Key. So what are some examples that you're seeing from your customers on effective communication strategies or techniques that they've implemented, whether that's something that you've helped them with, something the employer themselves has developed?
Yeah, be the best thief of all good ideas amongst anyone else in your field. I have a really cool group of HR professionals that are all using Ticket Health, and now they're getting together outside of just me hosting a benefits over breakfast semi-annual meeting or our meetings together where they're collaborating on ideas that work for them and they're stealing them from each other.
Right.
And I had one last week where we insure a bank. They do a thing called Perk Alert where it doesn't always have to do with benefits, but they allow all employees to make testimony, good or bad, out on basically their system, and it allows the others to see it and learn from it, and they get a $5 or $10 gift card when they do it. Another group stole that idea this past week on our call yesterday. She goes, I had 12 Perk Alert comments from people, and 11 of them were positive. So she goes, they're doing my job for me on teaching and then helping remind people of the different parts of the program, and it costs them basically nothing. A little bit of time to run it, of course. But that's one example of just sharing the wealth and having that ripple effect happen amongst them.
I've seen people create like LMS or modules that both family members and the employee can take, and incentivizing people taking like the new to your plan kind of thing. I've also seen that be live, where they've had people available to do kind of, I'm new to this plan, I need to understand it, and to be able to talk to somebody who has that level of expertise. Yep. I've also seen people are text messaging, like sending, just little tidbits of information out as the employer through text message. Email, again, knowing your audience, which is a thing I think, with your Jeopardy game that I heard from you, is like, understand what speaks to your employees, and try to use those. The thing that I find or that I hear that works the best is frequent. It can't just be 1 or 2 times, and never, because it again matters when it matters to me, and the rest of the time it doesn't matter at all.
Right.
Yeah, for the HR people in the room, teach your people to fish. Don't keep doing everything for them when it comes to filing claims and helping them find the resource. We use a really nice, beautiful benefit guide that's mainly electronic now for people, so it's readily available. Of course, we have people that want it always in print, and it's 40-some pages and all that great stuff. But we're using QR codes now a lot to get to greater information, but we're trying to hit them with like the 1 or 2 bullet point things. We sent out a postcard this week to all of our clients to their homes, so the spouses can see a reminder on one of those updates that we're making that we want them to know about. So it's really just there's a responsibility to the member, and we got to remind them, and don't shy away from sharing the real costs of healthcare at your business to them. Another employer of mine, the 2 HR professionals got on camera and just talked for 7 to 9 minutes about a first quarter update. They did such a great job, but behind them on screen was what healthcare costs have done to that company over 5 years. And of course that line is not always like this. It's not like this either, but it's reminding them we're all involved in it. And they also do a good job reminding them that when it comes to profit sharing and 401k matching, is what we spend today determines our premiums next year. And if we spend more this year, we don't get as much on all of our benefit package in the future. And so really treating them like adults and being honest about sometimes even the bad news is really important.
Yeah, I would agree. And I think it really goes back to just the creativity, because, post-COVID, you don't have people in the office anymore. You can't just hang up a little poster in the lunchroom. I think maybe manufacturing businesses are a little bit easier because it's word of mouth, like, oh, I went to this doctor, or oh, I used this part of my benefit, and that. But for a lot of folks that are home and working virtual, you do need to keep that top of mind, whether that's an email or whether that's a text. Whatever you can do to get the word out and keep educating them.
I don't think people, understand how healthcare works. And I think I've always said, if I was independently wealthy, like in high school, I learned how to sew a telephone. I cannot sew a button on anything today, but I learned nothing about healthcare. Like, when do I need to go to the ER? You have 3 kids under 5. Has anybody ever had a conversation with you about what's appropriate use of the ER? And if not, then what to do? So I also think being very aware that people don't understand that just because I go to the hospital, I'm now exposed to a bunch of stuff. People think that means it's a big deal or it's a good thing. And so I think we do not spend enough time just educating people about how to be a consumer of the healthcare dollar.
Agree. And I'll just put a tidbit in. Our marketing team from the Alliance has a really good flyer that has all that information on it. Like, when do I go to the ER? When do I go to urgent care? When do I seek care from my primary care physician? If you need one of those, I'd be happy to send one to you afterwards.
Tattoo it on
my arm, yeah.
That's assuming
barcode.
one reads.
Yeah,
So
true.
In a
Exactly.
world of TikTok videos and short videos that we live in, getting creative and making those short videos is how people learn I hate to say it, the best today,
Yeah.
but they just don't read as much as they once did. So meeting them where they are is really important with some of that.
Absolutely.
I throw myself on camera every other week, I think, for some silly message or just something that comes out of it. And it's just to that point. It's to educate them on things they're not going to remember. And that's why even simplifying the health plan and looking at what you're up to when it comes to, do we really need to keep complicating things with co-insurance in the future? Like, no one understands their EOBs, even though they're supposed to be more easily to read.
That means we add more to it, so now it's in, right?
Yeah, we gotta just keep looking at all those options out there.
Well, you just actually, you guys kind of went through responding to one of the questions I had, like really what role does technology play in communication? And you just hit on that.
Lots.
Yes,
Yeah.
it is key because everybody has their phone in front of them. And if it's not their phone, it's a laptop. Any way that you can utilize technology to get through to your employees. I mean, either any new creative ways? I mean, are you doing TikToks, Garrett?
I am not doing TikToks. I refuse. I've never been on TikTok.
Me neither.
Turned 40 this year, and I guess I'm finally can say stuff like that. I think our agency is investing a lot in AI right now. We're using AI in a lot of different capacities. And when I say AI, we're using AI and we're using how to automate better. And I would say if you're trying to cook the burgers the same way to some degree, it makes a little bit more of life easy for certain businesses all in the same region. I don't need to do things 30 different ways. I want proven methods that work, law of large numbers and volume to get the best deals as possible with the providers and the healthcare systems that are available, and then simplify, educate, and keep repeating that. But AI can come a long way. We teach our people how to use it for even writing emails to being on our webinars now to keep narrating summaries at the end of each webinar. So then we don't have to type up the whole summary ourselves.
Right.
Yeah.
That's awesome. Nicole, last question, because I just got the 10 minutes signed. So how can employers measure the effectiveness of their communication strategies during open enrollment? So really, you can put all this in place, but how do you measure that and make sure it's getting through? And
I mean, the things that I would look at, right, are utilization and what does that look like, right? Do ER visits go up even though I did this campaign and made sure everybody understood here's whose urgent care is in our network and here's telehealth and here's this, and yet my ER rates are still going up. I think engagement is another big one into programs, into things, and I've heard other people talk about that. Incentives, how many incentives have I given, whatever that incentive strategy is, because I think that to me is the biggest way to get people to engage. And then if you have the technology and the tools and all of that, but if the incentive is big enough, when the time comes, people engage. So, and then I think there's also the satisfaction, right? Like, are your employees happy? Do your employees complain all the time about your health plan, about your services, you know? That to me would be another way, and how much time you're spending. I love your point about the accountability piece and really making me accountable, because when I have to do it, then I learn how to do it right. And you know, it's kind of like with your kids, you're not helping teach them anything if you just always do it for them. It's the same sort of philosophy. But I think that's another way, is how much time am I having to do, and am I having to do this because I don't have a good engagement strategy?
Yeah, I agree with you. I think in a lot of our care navigation, we use a lot of cash incentives, but to earn the actual final cash incentive in your check there, you need to complete a 2-question survey. And one of those questions is, would you recommend that service to a fellow family member or coworker? And that one question can tell a lot about how they felt about being navigated towards high quality, fair price care. And then they can always expand upon that in a box to add some of that information. But that's been very helpful. As much as we want to have free, meaning employer paid primary care and all the rest of it, you do want to be constantly getting that stewardship report from your employees and their families and hearing that value to them and then sharing it with the rest of them for when it is good.
Yep, I agree.
I also think using other employees, and you mentioned that too, but as an HR, if you hear of a story that somebody has, use your employees, because people trust the employees a lot more than they trust the rest of us, and those stories can be very, very powerful.
I completely agree. They are your best advertising. Your employees are your best advertising, absolutely. So I am going to open this up because we have 5 minutes left. Open it up to the audience for questions. If anybody has a question, Mike is walking around with a microphone. We just ask that you do use the mic because we are recording this session, so we just want to make sure we hear your questions. Quiet
You were
group.
so thorough.
I know, you guys were so good. All right, then I'm going to ask one. I'll be the audience. How do we reach not only the employee, but the other decision maker in the house, the spouse, that's on the plan, and educate them about their plan choices? That is like the most common
That's
issue.
my favorite one, where I've seen the incentives work, and especially if it's new, to say, if your spouse, whoever covered dependents on the plan, they call and either have a new meeting or do this module where they get this information. I think making sure to think about that as part of your strategy, because oftentimes it isn't just the employee that's seeking the care. It
Right.
is somebody else that is running care, doing those sorts of things.
Absolutely.
I spend hours educating the employee to get the spouse to call and say, my husband usually, by the way, threw this packet at me when I got home. Can you go through this with me? And so, of course, we want them to know everything in there if they're the one ultimately making the decision. So we try to record a video of every open enrollment session or new hire session that gives them that tutorial, which usually could be 45 minutes to an hour, of course. I am a big proponent of face-to-face, employee-engaged open enrollment that is required, not voluntary. And I do not care if the member is not on your plan today. Every 12 months, they get to make a decision if they're going to be on your plan, and you need to start making them a healthcare consumer yesterday. Even the 20 to 26-year-olds that don't care about it until they have to, right? Because they will be your frequent flyers on ER, unfortunately. So I think we owe it to each other to say it can bankrupt you. Matter of fact, 75% bankruptcy is medical hardship in this country. So knowing this information is such an adult responsibility that we want to meet them there. So that's long-winded, but let's get the spouses involved. I love when they have open enrollment that might start at 5:30 or 6. Is that the best part of my job? Maybe not always, but at least if I get some of the spouses to come, it sure helps a whole heck of a lot later on in the year. Or trying to meet them at some other time. But using videos helps with that too.
And I think, I'm going to play on that because I think the mandatory piece is really key. And I know people hate that word mandatory, but my husband actually does work for an employer that the insurance center manages. And so he came home with a book and put it on the counter, and he said, I had to go to this, but I really didn't pay all that much attention. I figured you'd answer.
I didn't know that till now.
He said, I'd figured you'd answer all these questions for me anyway. And I thought, oh, really? But he absolutely did learn something, and he did actually ask me questions about the benefit plan, which he's not even on because of who I work for. But that was I think that's amazing. Like, we should, as an employer, I think that is extremely
We
important.
have free marriage counseling in all of our plans too. So when that happens.
Absolutely, but I do think that is the best way to get to spouses. So, yeah, I think it's great. So, well, I really can't thank you guys enough.
Thank you.
For being on the panel. We really do appreciate that.
I do have if you want a postcard, come see me afterwards. I'd be willing to share my Jeopardy game with you so that you could think about that. Even the other consultants in the room, that's fine too. So
Thank you.
Education's everything to your members, but getting them to look at it through a different lens is so important. It makes everybody better.
I agree. Well, please join me in extending a sincere thank you to Nicole and Garrett. We do really appreciate you donating your time and being
thank
here
you for asking us.
and talking to this group and just sharing your observations with us. So I think the Jeopardy, I am even interested in that. So